Let's review. Pharmacology. Our category for this video is 100 Most Common according to Katzung. Are you ready? Good luck! Most common adverse effect of diuretics. Potassium depletion. Most common undesirable effect of methyldopa. Sedation. Most common drug used for erectile dysfunction who do not respond to sildenafil. Alprostadil. Most common site of digitalis toxicity outside the heart. Gastrointestinal tract. Most common diuretic used in heart failure. Furosemide. Most common indication for use of carbonic anhydrase. Glaucoma. Most common reversible cause of confusional states in the elderly. Overuse of sedative hypnotics. Most common drug abuse in the world. Alcohol. Most common medical complication of alcohol. Liver disease. Most common neurologic abnormality in chronic alcoholism. Generalized symmetric peripheral nerve injury. Most common hematologic disorder seen in chronic drinkers. Alcohol-related folic acid deficiency. Most common congenital malformation associated with valproate. Spina bifida. Most common dyskinesia following levodopa therapy. Chorioathetosis of the face and distal extremities. Most common adverse effect of clonidine. Sedation. Most common psychotic disorder. Schizophrenia. Most common side effects of lithium. Polyuria and subclinical hypothyroidism. Most common antidepressant in clinical use. Fluoxetine. Most common side effects of tricyclic antidepressants. Anticholinergic effects. Most common side effects of 5-HT2 antagonists. Sedation and gastrointestinal disturbances. Most common side effects of MAO inhibitors. Orthostatic hypotension and weight gain. Most common cause of iron deficiency anemia in adults. Blood loss. Most common cause of iron deficiency anemia in men and postmenopausal women. Blood loss in the GI tract. Most common side effects of erythropoietin. Hypertension and thrombotic complications. Most common side effects of methotrexate. Nausea and stomatitis. Most common side effect of methimazole. Maculopapular rash. Let's take a break. Back to the test. Most common problem in using progestins. Breakthrough bleeding. Most common side effect of clomiphene citrate. Hot flushes. Most common side effects of sulfonylureas. Hypoglycemia and weight gain. Most common side effect of metformin. Gastrointestinal effects. Most common complication of insulin therapy. Hypoglycemic reactions. Most common mechanism of resistance to penicillin and beta-lactams. Beta-lactamase production. Most common side effect of linezolid. Thrombocytopenia. Most common major toxic effect of isoniazid. Hepatitis. Most common serious adverse effect of ethambutol. Retrobulbar neuritis. Most common adverse effects of streptomycin. Vertigo and hearing loss. Most common adverse effect of ganciclovir. Myelosuppression. Most common adverse effect of zidovudine. Macrocytic anemia and neutropenia. Most common cause of contact hypersensitivity. Poison ivy. Most commonly used oral premedication for general anesthesia for children. Midazolam. Most common cause of bronchospasm after induction of general anesthesia. Insertion of an endotracheal tube. Most commonly prescribed second-generation antipsychotic in the United States. Aripiprazole. Most common application of antidepressants. Major depression. Most commonly prescribed first-line agents in the treatment of both MDD and anxiety disorders. SSRI. Most common full opioid agonist in transdermal application. Transdermal fentanyl patch. Most commonly abused sedative hypnotics after ethanol. Barbiturates. Most common cause of chronic anemia. Iron deficiency. Most common route for administering iron dextrin. Intravenous route. Most common patients developing chronic iron toxicity. Patients with inherited hemochromatosis. Most commonly used cytokine for peripheral blood stem cell mobilization. GCSF. Most common defect in the natural anticoagulant system. Mutation in factor V. Let's take a break. Back to the test. Most common thrombotic event in heparin-induced thrombocytopenia. Venous thrombosis. Most common patients where warfarin resistance occurs. Patients with advanced cancers of gastrointestinal origin. Most common adverse effects of interleukin-1 inhibitors. Injection site reactions and upper respiratory tract infections. Most common toxicities of methotrexate use. Nausea and stomatitis. Most common use of colchicine. Prophylaxis against gouty attack. Most common oral corticosteroid used. Prednisone. Most common clinical use of FSH, LH, and HCG. Controlled ovarian stimulation. Most common cause of hypothyroidism in the United States. Hashimoto thyroiditis. Most common form of hyperthyroidism. Graves' disease. Most common cause of non-toxic goiter worldwide. Iodide deficiency. Most common defect in synthesis of cortisol. Decrease or lack of 21-alpha hydroxylase activity. Most commonly prescribed salt-retaining hormone. Fludrocortisone. Most common type of type 1 diabetes. Type 1 or immune-mediated type. Most common adverse effect of inhaled insulin. Cough. Most common cause of hypercalcemia. Tertiary hyperparathyroidism. Most common associated condition in osteoporosis. Menopause. Most common side effect of systemic azole drugs. Gastrointestinal upset. Most common agent used for the treatment of mucocutaneous candidiasis. Fluconazole. Most common agent used for suppression of local candida infections. Nystatin. Most common adverse effect of imiquimod. Local skin reactions. Most common inorganic silver salt formerly used for gonococcal ophthalmitis in newborns. Silver nitrate. Most common cancer in children. Acute lymphoblastic leukemia. Most common leukemia in adults. Acute myelogenous leukemia. Most common gastrointestinal malignancy. Colorectal cancer. Most common source of human exposure to oxides of nitrogen. Automobile and truck traffic emissions. Let's take a break. Back to the test. Most common cause of industrial lead poisoning. Absorption of lead dust via the respiratory tract. Most common cause of gastrointestinal signs and symptom appearing in a group of individuals within several hours of a common meal. Bacterial food poisoning. Most common causes of death due to overdoses of narcotics and sedative hypnotic drugs. Airway obstruction, aspiration, or respiratory arrest. Most common cause of aspirin poisoning in the elderly. Confused dosing. Most common manifestations of beta blocker toxicity. Bradycardia and hypotension. Most common venomous reptiles in the United States. Rattlesnakes. Most common cause of blindness in the elderly in the developed world. Age-related macular degeneration. Most common side effect of tacrolimus and pimecrolimus. Burning sensation in the applied area that improves with continued use. Most common adverse effects of topical retinoic acid. Erythema and dryness that occur in the first few weeks of use. Most commonly recommended treatment regimen for H. pylori-associated ulcers. Triple therapy. Most common adverse effects of metoclopramide. Central nervous system effects. Most common cause of portal hypertension. Chronic liver disease. Most common muscarinic receptors in glandular and smooth muscle cells. M3. Most common vascular tumors of infancy. Infantile hemangiomas. Most common cardiovascular disease. Hypertension. Most common drugs used in patients who have had adverse reactions to ACE inhibitors. Angiotensin receptor blocking drugs. Most common condition involving tissue ischemia in which vasodilator drugs are used. Angina pectoris. Most common cause of angina. Atheromatous obstruction of the large coronary vessels. Most common cause of heart failure in the United States. Coronary artery disease. Most common sustained arrhythmia observed clinically. Atrial fibrillation. Most common undesirable side effects of H1 antihistamines. Sedation and antimuscarinic actions. Most common use of PGE2 analogs. Promote labor through ripening of the cervix. Most common cause of chronic pancreatitis in the Western world. Chronic alcohol ingestion. Most common dose-related side effects of phenytoin. Diplopia and ataxia. Most common use of propofol. Facilitate induction of general anesthesia. How did you do? If you find this video useful, consider giving this video a like. Your support greatly helps this channel. Remember to click the subscribe button so you will be updated of future review videos like this. Study hard, and see you on the next review video.